Good morning, everybody. As the panel comes up to join us, I will begin the introductions. I'm Natalie Gauckner. I serve as an Associate Dean in the David Eccles School of Business and direct something called the Kem C. Gardner Policy Institute, and it's really a pleasure to be with you today. I've been to these conferences before in the past, and I always leave feeling like the world's in good care, which is something you can't always say. It's a beautiful day, and I feel it's Friday, the Jazz play tonight. I used to work at the Salt Lake Chamber, and we would always call this a Chamber of Commerce kind of day, and we're all here, so we've got a lot of reasons to smile. I was thinking, Stephanie and I were speaking just before, she's got a friend in town who's up skiing today, and I'm thinking, you know, you can golf today, you can ski today. We use that term for those of you that are from out of state, that in Salt Lake City you can have a cabin in the city. Pretty awesome. And I hope we can live up to that awesome with this great panel. And I'm going to introduce it by kind of saying that, we're here today to explore these innovative ways to address social, financial, and economic issues related to disabilities. And I have this metaphor in my mind. You often hear the term melting pot. And, that usually is talking about sort of cultural integration in this country, but there's this other term that's sometimes used, it's used by Peggy Noonan, and she uses the term Sunday stew. So I want you to just kind of envision a Sunday stew and all of the warmth and diversity of that stew, and that what really holds that stew together is this strong broth, this nice broth that makes it so yummy and good. And I think of that broth, at least for today's work, as corporate and civic responsibility for the people in our state. And we are going to explore that on this panel because we have some experts in government and some experts in business who are going to help us think through this. One more thing I just add, and you'll hear a little bit more of this from the panelists, but we have a state that has among the lowest unemployment rates in the country. Right now, the unemployment rate in Utah stands at 3.4%. Now, I'm an economist by training, so I know more about this than I would care to admit, but we know that you can approximately double that rate if you really want to get at true unemployment, because not everybody is actively looking for work, some are discouraged and whatnot. But we also know that among people with disabilities, the unemployment rate is much, much higher, 8 to 12%, and then so many of them are not actively looking for work that if we probe deeper, that we could get as high as 80% of the people with disabilities in this state who would like a job and do not have one. And so there's an enormous responsibility for us to explore ways to help with that. On our panel today, and I've got to just admit, I've always called Stephanie McKay, and then I heard Mackay, and I was like, I'm going to get that right. And I was a Chi Omega, so that's how I kind of remembered to do Mackay or whatever. But Stephanie, many of you know, is the Chief Innovation Officer here at Columbus Community Center. She's going to speak to us first. She's led these successful capital campaigns. She has experience in higher education with the corporate world, the nonprofit world. You'll note that she was in 2015 listed as one of 30 women to watch in our state. And I think that's just wonderful. But I have to tell you that I think it's more that Stephanie is one of 30 people to admire in this state because of her talent, because of her warmth, because of her grace. And so we'll be really privileged to hear from her. I'm going to just go ahead and introduce everybody and then let them just go boom, boom, boom. After Stephanie, we're going to hear from Angie. And is it Pina? Pina. Angie and I have not met. And I don't have a lot of background on Angie, but I am sure you are also one of the 30 women to admire. And if you wouldn't mind, as you begin, do you mind giving us a little bit more background on yourself? Okay. Just share that with us, because we have not met. Sure. And she's the current interim executive director, if I have this right, for the Division of Services for People with Disabilities. Close?
Interim director.
Interim director. Yes. Okay, very good. And then after Angie, we're going to hear from Darren Brush. Now, Darren and I do know each other pretty well. And Darren is an expert at a lot of things: housing, workforce services, employment services, workforce development, an overall great guy. And I'm going to be happy to hear from you today, Darren. And then we'll close out the panel before we do a little bit of question and answer with Mr. Val Hell, who is the Chief Economics Officer for the state, directs the Governor's Office of Economic Development, and I might add is an author of a great book, if they don't have it in the back room, called 7 Keys for Purposeful Living. I have read the book, and it helps you live a life that matters. But more than that, for today, he's oversees the Utah economy and the good things happening here for Governor Herbert. So with that, we'll turn the time to Stephanie.
Thank you for that wonderful introduction, by the way. I really appreciate that. I wanted to give some context to the discussion that we were going to have today. We have a lot of great governmental agencies that provide a lot of support for our state, and so I'm so thrilled to be here with my colleagues. But I wanted to give them and to give you kind of some perspective about what we're looking for as I talked about connecting dots and moving forward. And I really wanted to just give you a feeling for what it's like for families with children with disabilities, how they kind of work their way into the world and what that looks like as they approach adulthood. So first of all, I just wanted to give you, I want to focus on the young adults who are coming out of the public school system, the 20-somethings, and just give you a little historical perspective that we really are millennials now, our 20 and 30-year-olds, are really the post-ADA generation. So as I mentioned, our founding parents who started things in 1952, they had no legal protection, no civil rights, nothing. And we kind of take it for granted that since 1975, kids can go to school. They're protected under the ADA. They have protections in the school districts, and they can receive services till they're 22. But when they hit that age of 22, they actually start to hit what they call the services cliff, and the bubble of public education and all the services that they've had just fall off. And so what I'm seeing now is a resurgence of grassroots families coming out and saying, my child is in his 20s and we really want something for them, and we just don't know where we're going to go with that. Just in general, so you have perspective about disabilities, 1 in 5 individuals in the general population has a disability. 1 in 10 families in Utah is impacted by a developmental disability, and 1 in 11 adults is of working age is not working in the community. So in a room of 100 people, we have 10 or 12 empty seats basically for people who should be here but aren't because of disabilities. Just some basic labor statistics. I won't really stress this too much, but the unemployment rate, we're down to 3.5% in Utah, but the overall unemployment rate for people with disabilities is 12%, and it can go as high as 80% for young adults with autism. So really three generations after the public law passed, we really do have significant unemployment, but we have a generation who wants to be out there with their peers working. So I wanted to just let you see what it's like for a family with a young adult kind of working their way into adulthood. All of the federal laws, regulations, rules that are in place to protect people with disabilities. I'm not going to go into much detail, but you can see down the far side that there's hardly a federal government agency that doesn't have some oversight or some regulation that protects people with disabilities. But that is an incredibly difficult situation to kind of negotiate your way through. Next slide. And you can see I just did this as a flow chart to really show you what it's like, that when you have all these great federal protections, but when it starts to flow down to the family and you get down to the family trying to figure out what kind of services they're going to get or support they're going to get, they have layers and layers and layers of stuff that even the most competent and savvy parents will just come in with the deer in the headlight look and to say, I just don't even know where to start for my adult child and what to do. So what I really wanted to do is, the important point I want to leave today is the comparison of a family with a disability and without a disability. And I've processed this over a number of years with my staff. And this cycle here is really what I want to focus on. You have you're a parent, I have a 26 and a 28-year-old. They go through public school. You hope they get out there and get a job. I'm still working on my kids on that one. They they get the paycheck, they get the benefits, they start their own families, and they get into that cycle of building wealth and contributing and paying taxes and learning how to complain about paying taxes. And then over time, you see generations building and acquiring wealth and giving back to the community through work, establishing stability in their own families. And then the cycle happens again, and then you have the grandchildren and the great-grandchildren, and you hope that keeps cycling through. The life cycle of a family with a disability, I spent hours and hours talking to my staff about this to distill this into a single cycle here. But really, the family has the child with the disability. They enter more into the medical piece and medical diagnosis. They get to go to public school. They have the protections of public school. They have the funding. But when they hit the age of 22, when they're aging out, and many of you already know this, they really have to start kicking into other government entitlements and social services to help them. And the employment piece tends to really elude people. I mean, the statistics tell us that. So we see kind of a redistribution of wealth around trying to manage a disability. So we don't see that really robust cycle of employment and what that brings to us over a lifetime. And so this is the normal cliff. You see, you don't even have to read the details, but you socialize your kids, they're well child checks, you're moving on, you're getting medical care, you're going to school, and then hopefully they finish school and they go out and work and they take care of you when you're old. So it's a pretty steady. Next slide. And I just want you to see where this 16 to 22-year-old phase goes, all the things that are added to that if you have a child with a disability. This is really kind of where the cliff happens. You've got to make decisions about Social Security, about guardianship, all kinds of things that are just absolutely stymie families. Like I said, even the most confident parents really are challenged. And then they hit the age of 23, they're out of public school. And we often call it the cliff where kids just kind of fall off and we don't see them again for quite a while unless they go into crisis. So this is, we have a board member, Mike Willard's here today. His daughter, Sarah, is a classic example of this. She is working now. She's in a program that we run with Intermountain Healthcare. She has a job. She has a very robust life, but I've had many conversations with Mike, who's a competent executive at a large company, and having to deal with that cliff. I mean, that's been his life. And parents just often come to us with that deer in the headlight look, and it's really it's a challenging time in life, and parents are starting to age, and the children want to be out with their peers, and they want to have a life like everyone else. So next slide, please. And you can see the team behind Sarah that makes it work. I had her there with her family and her bosses from Intermountain Healthcare, and it takes a team. And my colleagues at the table all contribute to that as well. But what I wanted to leave you with is the thought that if you compare the two families' approaches, with a disability and without a disability, that my challenge to us and some of the discussions I'd like to see in this event today is where can we find innovation where we can kind of cross over those two cycles, and we can find opportunities for families, get folks out working with disabilities, and get them contributing into that cycle where the employment and the paycheck is really putting them on a track where they're not getting lost out in the community, and we're not seeing them and they're not a part of us. Next slide. Utah is the perfect place for this. We have a low unemployment rate. We have a service culture here. We have lots of services co-located here, and we just have we have an entrepreneurial climate. We have lots of really good things going on. So in the end, I'm going to take you back to my opening remarks. It's really about what can we do with all of these services and funding sources and government, local, businesses to surround the family and give them the kind of trust and hope and access to employment and integration in the community. And how can we start to do that in an evidence-based way? How can we do that in a humane way? And how can we do that in a very highly collaborative way? So I'd like to turn this over to Angie to talk about some of the ways that we actually do that.
Okay, so just a quick introduction of myself. I'm Angie Pina, and I work for the Division of Services for People with Disabilities. That's part of the Department of Human Services in the state of Utah. I'm sorry you guys don't get to have Paul Smith up here. You're definitely missing out on someone great. He's our director, and today is his last day. So I am interim. I actually started working in the disabilities field here at Columbus. I've done support coordination, and I've worked for the state for quite a while. So one of the things that the division does, one of the things that the state as a whole has actually done has established what's called employment first policy. So we have legislation that focuses on making sure people with disabilities, whether they're developmental, mental health, whatever they may be, are employed, have the opportunity to be employed. In our division, we have a person, her name is Tricia Jones Parkin, and her job specifically is developing employment options, making employment possible, helping it be successful. She's exceptional. She has presented in multiple states. She's recognized for her skills, her innovation, and she's doing an excellent job in our state. We collaborate a lot with Voc Rehab in providing services and in trying to make sure they're services that are effective. One thing that we do believe is that every person is employable. We're not putting some kind of limitations on anyone that we're serving. It's an option out there for everyone, and it's something that we're asking everyone to look at first before just going to something else. We don't want to, we just don't want to limit the spectrum of options that people have. And we also believe that everyone is a contributing member of our society, that everyone has something to give and has relationships to give and to build. So we really have focused on working with one person at a time. So not working like with a group of person to get them all employed, because that's a much harder thing to do. It makes a lot more sense to be working one-on-one with a person, figuring out what it is that they're interested in, what it is that they're good at, and then figuring out what kind of job fits into what they're doing. To help us transition into kind of more successful employment, we have contracted with a company called Griffin Hammis. If you guys are familiar with them, they're definitely one of the national leaders in employment for people with disabilities. They've been working on helping, I don't know if you know the term, job coaches. So people who help someone with a disability get a job, do job development, career development. So they've been working on helping them go through a process that's called discovery. So it's a process that helps someone learn how to find out what it is that someone's good at, what it is that they want to do, what it is that they're interested in, and then move forward to help them find that job, develop that job, and be successful there. We also have funding from the Office of Disability Employment Policy, who's working with us, and so in that group it's pretty big. We have Voc Rehab at the table, the Office of Education, the Department of Health, Substance Abuse and Mental Health, and some others. Sorry, they're not coming to mind immediately. But what we're doing is working together to make sure that we're, one, talking the same language, so that someone is working between our agencies, they're getting the same message and they're understanding the same thing. And so when we're serving people together, that we can do it most effectively and that there's a smooth transition between services. So we've been working also on making sure that the services we have are effective, and so we've been looking at those services about kind of refining those so that they are the services that we need to meet the employment goals of people we serve. One final thing we're doing really to help start employment early is we have some pilot projects with 3 school districts right now. So we're in 6 school districts. We're in 6 schools, and we're working, so Voc Rehab is involved in that as well. So it's workforce, the school districts, Voc Rehab, and the Division of Services for People with Disabilities. And we're working with kids who are 14 and older, so that we're starting to look at how to help them be employed by the time they get out of school. So they have the same opportunities, they get employment experience while they're in school, kind of just similar to what their peers would do. You start getting your work experience in school. And so that when they graduate from school, that they have already an employment option or are already employed or at a point where they could. So we're working together to try and make sure that transition is happening as well, so that people are prepared from their youth as they're coming. And one final thing we're working on with the Developmental Disabilities Council is outreach to parents to help them know what options are out there, work with them to understand where they're coming from and help them understand the goal of our employment goals and where we're headed.
It's a real honor to be with you. Thank you. I had no idea that I'd recognize so many folks and be able to see colleagues I haven't seen for a time. It's quite an honor for me also to be here with Columbus Community Center. Congratulations on 50 years. It's an organization I've admired for a long time, long before I came to the State Office of Rehabilitation, which was 9 months ago today. So at this point, I own all the problems of the past, those of my own making, and people assume that I know what I'm talking about, and I still can't find half the conference rooms in the building. So, and it's fun for me to be, gosh, what a panel, but also what a moderator. Natalie and I have known each other probably close to 20 years, and we have an interesting relationship. It's sort of a drive-by relationship. We see each other in really weird places, and we usually have about 30 seconds to talk. And so, again, same situation, but what a treat for me. So I'm Darren Brush. I'm Executive Director of the State Office of Rehabilitation, and Stephanie and I planned for my presentation, we felt that it was important to give some context to this conversation because there are many things going on with the State Office of Rehabilitation that are important to understand as we talk about connecting these dots and how they will affect that. So let's see. Oh, point over here, right? So the State Office of Rehabilitation is the oldest public social services agency in the state of Utah. It's been around nearly 100 years. It began as a small agency helping World War I veterans who were injured during the war get training and reattached to the workforce. That's how long it's been around. Our mission is to help Utahns with disabilities achieve really 3 things: rehabilitation, and that's a spectrum; employment, and that's a spectrum; and independence, and that's a spectrum. So you have a 3-dimensional spectrum that extends infinitely in both directions, and that's important for our conversation as we move forward. It's often forgotten that we are or unknown that we are 4 divisions. So we talk about, Angie talked about Voc Rehab, the Division of Rehabilitation Services. It's our largest division, but we are also 3 other divisions. We have the Division of Services to the blind and visually impaired, services for the deaf and hard of hearing, and the Disability Determination Services, which looks a lot like a federal agency, but they're state employees administering social security benefits, eligibility, and determination and ongoing eligibility. So all of those relate to one another because we serve in all those capacities people with disabilities. I will pause here just for a moment and say that one of the reasons I find the job so rewarding is because I have disabled family members. I've always admired the State Office of Rehabilitation as I've worked with them for years, both in housing, prior to that in workforce development. My mother's disabled, my sister's disabled. I knew the organization, and it was hard to resist the call when it came. We are an $86 million agency. About $50 million of that budget is the vocational rehabilitation program, and our funding mix is about 3/4 federal and the rest state. And there are more than 400 employees at the State Office of Rehabilitation. Well, that is small, isn't it? So as I mentioned, well, let's talk about vocational rehabilitation because that has the greatest overlap, I think, with what we're discussing today. Again, that is a federal program. That money, that federal money comes in on a 2-year grant, every year as a 2-year grant on a federal fiscal year. I share that because there's a state maintenance of effort required, and if you're familiar with the audit that maybe came out, got a lot of press back in September, USOR, over the course of the last several years, got its budget way out of whack, and that had to do with not sufficiently maintaining that maintenance of effort, challenges with bringing in far too many clients that we were unable to serve given our funding. And so things in a hurry got out of control with the budget. In addition to that, services had grown significantly after the economic downturn, such that cases were, we had over 30,000 vocational rehabilitation cases, or people in the pipeline to be served. We are at exactly half that right now, to give you some basis of comparison. What that meant is that prior to my arrival, USOR sought 2 supplemental appropriations for the legislature. You usually get away with 1 of those, but you don't get away with 2. And that led to very dramatic results. And we reconstituted our management team. I arrived, reconstituted a management team. Let's go to the next slide, if we may. So we were ultimately overspent in our vocational rehabilitation program somewhere in the neighborhood of 20 to 30%, and we had to take drastic steps. We eliminated 43 positions at the State Office of Rehabilitation in the last 24 months. We will eliminate another 14 before July 1st to make our budget. We had come to live on an inflated, bloated budget that depended on one-time money from the feds, one-time money from the state, and that doesn't work when you have a program that has a maintenance of effort. And we are adjusting back to what our base budget should have been 3 or 4 years ago. I came on board, we've appointed a finance director. It's been my opportunity, my honor to appoint a fabulous management team that has a handle on this. We put together a 3-year work plan to get a handle on all these things. It wasn't just the budget issues. I think one of the core failures in our system was we didn't know what it cost to serve a client. And we got our hands around that very, very quickly. We were able to quantify that, and we were able to backtest that 9 years to prove it up. And so one of the steps that was taken prior to my arrival back in February was you only have one tool to slow the flow of clients into your system. That's called an order of selection. That's what the feds give you. That amounts to a waiting list. A waiting list categorized by the disability, not disability types, but the barriers to employment and the significance of the disabilities. And so you create 3 tiers: most significantly disabled, and disabled. Those are the only 3 that are allowed. And when people are assessed and found eligible, they move into those categories, and you serve from the top down, the most significantly disabled. That is good, but it creates a number of challenges, if we may. There are I talked about most of that, but what I will suggest is that creating those waiting lists is not ideal. And we didn't think that we would be able to open the waiting lists within the first year. Frankly, we talked internally about the first 18 to 24 months. So job 1 was to get this case service expenditure rate model, we call it, in place so we could predict. And last September, so we went on the order selection in February. In September, we opened the most significantly disabled category, began moving clients off, and have left it open because we knew how much it cost to serve a client at that point. We also had the advantage of the fact that we'd gone on order selection, and as Stephanie talks about a cliff, for us that was a big cliff because what it did is it just shut off services to new clients. And so you immediately have a cost savings. You had to understand that and then predict what it would cost to serve additional clients, which is what we did. And we were proud in September to open that category. Since then, the second category is significantly disabled. And when we talk about employment first, we're talking about these categories primarily for vocational rehabilitation. That second category, we began moving clients off of that category. We moved 1,500 off, leaving about somewhere around 2,500 right now, almost 2,500. We're proud of that. We're sort of bringing those in. That was my time signature, by the way. Just not randomly saying thank you to people. Although thank you. And move 1,500 additional clients in. We're watching to see what that means. Our hope is to do more, but we're well ahead of my own personal schedule in terms of moving people off the order of selection. Guess we better get to the next. These are the last two, so we're in good shape. So that's important context as we talk about an employment philosophy for vocational rehabilitation. So as my colleagues have said, it's not about a job. It's about helping someone achieve, as we talked about, first, the proper level of rehabilitation. What does it take to restore? What does it take to rehabilitate? A very individualized process. And then providing job coaching and exposure to the world of work and what that looks like to find the right employment fit and the right supports in the process so that degree of independence, that maximum degree of independence can be achieved. We believe that people with disabilities have the right to achieve competitive, integrated employment, that it works best when they work beside individuals who don't have disabilities, when it's all integrated. Employment should be meaningful, should enrich one's life. We all seek for that, and people with disabilities are no different. And it looks very different. Employment can look very different. It could be 40 hours a week, it could be 6 hours a week, depending on the situation. It could be working for someone, a nonprofit, a combination of internship, volunteer, or it could be starting your own business or being part of that. That's what it looks like for us. Final slide. So I was asked to come fix the agency, a mission about which I am extremely passionate. And then somewhere along the way, things changed. And the legislature said, we appreciate that, we have confidence in you, but we've got to change this oversight thing so that this doesn't happen again. And so in this last session, the legislature passed legislation to move us to the Department of Workforce Services. Deja vu for me. And not only do that, but do that by October 1st. In fact, we are having a meeting right now that I'm supposed to be chairing where we're talking about the work groups that we've put in place to do that. So that changes a lot of what reform we can accomplish because we're moving toward transition. That work will continue, but we're having to prioritize. The Workforce Innovation and Opportunity Act, the new federal act, changes things because we are mutually dependent on our own outcomes with workforce development programs and adult education. The federal emphasis on pre-employment transition services, we talked a lot about youth on this panel so far. Youth are a tremendous focus of ours. We believe everything that Stephanie and Angie said, and we are a participant with that, so much so that 15% of our resources now go to that age group 16 up to the 22nd birthday. And then we continue the reforms that we have underway because we believe that the best services come from an agency that's well run. Thank you.
Thank you, Darren. As Natalie mentioned, my name is Val Hale. I'm Executive Director of the Governor's Office of Economic Development, and it's my responsibility to talk a little bit about the economy and business and how we can partner business with public-private opportunities. As Natalie set the stage earlier, it goes without saying, and sometimes we don't realize how good we have things here in Utah, but Utah, our economy is the best in the country, maybe even the best in the world. We have been enjoying an incredible string of success here economically for the last few years. The U.S. Chamber of Commerce grades states in 6 different areas, and Utah for the last 3 years has been named by the U.S. Chamber as the most enterprising state with the best economy, the best foundation in the state, in the country economically. We receive accolades almost weekly. I've taken to calling us the superlative state because Everyone's calling us the best of this, the most of that. It's really rewarding and interesting to be in that situation. We have so many good things going right now, and probably the reason for that is that we have the third most diverse economy in the country. A lot of people don't realize that, but it used to be we were very much a mining state. We had, I'm from Utah Valley, we had Geneva Steel, we had BYU, we had agriculture. That was about it. If you go to Utah Valley today, Geneva Steel is gone, and you have a lot of technology, a lot of manufacturing, still a little bit of agriculture in the south end of the county, but most of the orchards are gone, and we see that throughout the entire state. We have a very diverse economy, tremendous aerospace and defense program that's growing. We have an amazing financial sector here in Utah. People don't realize that about 2/3 of all of the industrial banks in the United States are headquartered here in Utah. And many people have to say, what? But we have a very strong financial industry here in the state. We have, of course, a thriving IT sector, which has been growing exponentially almost over the years. We have energy, which right now is down a little bit, but that's the beauty of our diverse economy. When things go south in the basin, it doesn't impact us because that's only about 10 to 12% of our economy. We also have a life sciences sector here that's very strong. So that diversity really keeps our economy churning along. So when there's a downturn in one area, it doesn't impact us in a significantly negative way, similar to what they're experiencing in South Dakota, North Dakota, and some of the energy states right now. And the thing that, of course, we attribute that to is that we've been very smart in a lot of the things we've done. We've had a favorable tax system here that's been favorable to business. We have a lot of policies in place that have been put there by the governor, the legislature, but it's also the people. We're a very entrepreneurial people. We're a people not afraid to take risks and start businesses. And it's a little bit eye-opening to people from other states and communities when they come here and see what we're doing. One of the most popular or frequently asked questions that we get is, why Utah? And it really is, I think it boils down to the people. We just have people that are collaborative. We work together. I was in a meeting 2 days ago with a company, and we were talking about the Utah Education Network. We have the most amazing internet network with our schools in the world. I mean, there's nothing like it in the United States or even the world in terms of how our schools are connected. And they talked about how Idaho has tried to do the same thing, and they have failed miserably because they haven't been able to collaborate and come together. And in Utah, we got the IT industry, we got the broadband industry, we got our schools together, we got everything, and we created this wonderful infrastructure that is benefiting our school children and, quite frankly, our business community throughout the state. But in Idaho, they couldn't get all those people to come together and make it happen. And so they're still struggling to get where we have arrived. And it's because of collaboration in many instances that we're able to do what we need to do. As many of you know, we're the #1 state in the country for volunteerism. We're the youngest state in the union, and we've got a lot of millennials, and sometimes the millennials get a black eye. People are critical of the millennials, but they are the most socially conscious generation that we've had yet. They are very concerned about the future. And we've seen the rise now of things like the benefit corporations. A couple of years ago, the legislature passed regulation that allows businesses to incorporate as benefit corporations, meaning they don't have to focus on the bottom line. They can have as a purpose and a focus social good. And we have 17 such businesses now in the state that have incorporated as benefit corporations so that they can be socially conscious. They can spend some of their money doing good rather than just returning it to their shareholders. And I think that's a real step in the right direction. We have so many good things going on, and in GOED we're proud to be supportive of the Columbus Center. I guess we're one of the early adopters of your qualified worker program. We use them to do a lot of for our tourism, collating a lot of the materials. We have our Governor's Economic Summit coming up on April 15. I'll put in a shameless plug for that. It's going to be a phenomenal all-day conference on innovation here in the state with a lineup that you would just be amazed with of speakers. And we actually have these workers here that put together and help us assemble the material for that. So we're very pleased and excited about what's going on here. I came with my staff a couple of months ago, took a tour of the facility, become better acquainted what's going on. And it really opened my eyes as to the possibilities of what's available if companies will just look around and see how can we help these people. What can we do to provide opportunities for them to help us? And it was really exciting for me to see what's available here and how there's an opportunity to really help these people be productive. And since then, I've been looking for opportunities to talk to businesses and tell them that they really have an opportunity and need to step up. They need to step up and help these people, young people, even older people in this situation. So I'm excited about the future of our state economically. I'm excited about the future of the Columbus Center, the new opportunities that they went to the legislature this year seeking some funding for their new facility, which is going to be amazing. And fortunately, they got an appropriation, not enough, but it's a good start. And so we are in Utah what we are because we are a community of people who care. And we need to make sure that in the business community, they have that feeling of caring and social responsibility. We only are as good as how we take care of those among us who need our help. That's my opinion, and so I'm excited to help out. Thank you.
Okay, we have a few minutes to ask some questions, and I'm going to just kind of pepper the panel a little bit. At the very beginning, Stephanie mentioned that she thought that Utah was the perfect place to innovate. And I want to ask the other panelists if you agree with Stephanie and why. Why is Utah the perfect place to innovate when it comes to serving people with disabilities?
For all the reasons Val mentioned, and because I think having left state government, so we have a great economic environment in Utah, and we tend to weather the storms very well. There's a great deal of consistency to our economy and the diversity that Val talked about. But having left state government for a decade and returned back, that's the other thing I admire, is the tone in state government in terms of collaboration and innovation too. And that's one of the things that appealed to me about coming back to the job. I will say one other thought is that we have employers who are willing to employ individuals with disabilities, and I think there's an emerging passion in this area that we will take advantage of. Of course, it's fed by the fact that the economy is good, the unemployment rate is low, there is a need for workers, there is a need for skilled employees, and people with disabilities can help meet that need. But what we hear time in and time again is that when employers hire and they in that sense innovate and take advantage of this part of the diverse workforce, is that they're so pleased with the results and what that means in their workplace. And we've started to call it the disability mojo that we give to employers. Okay. And I think that's part of the innovation that's occurring. It's more expected and less resisted. And that's good because as the economy stays strong, or while the economy is strong, one of the things we know is that we move in cycles. We need to take advantage of that now so that we create those expectations and those opportunities and benefits are realized. so that we can weather it when it's not as strong. So I think that all the reasons the panelists, and especially Val, pointed to are the innovation that happened in Utah that make this possible.
Angie, would you add anything?
I was just thinking one of the things I think I would add is that I think in Utah people really see anything as a community issue. So serving people with a disability or not, we're all part of a community, and I think our communities do seek to be inclusive of everyone, and I think also just people are always looking for something better. It's not a place where people just kind of settle, but they're always looking to improve and to do something better. So
Yeah.
that's all I'd add.
Yeah, interesting. I don't know if Val, if you want to add, or it sounds like you feel like you covered it. Okay, I don't know about the audience, but I had this sort of bifurcated feeling as the panelists were speaking, and that was, we're great, we're the superlative economy, we have so many things going well here, prosperity, low unemployment, all the, wonderful things Columbus Community Center contributes to this community. And then we have this massive restructuring and all these cuts of people that serve. And Stephanie, I wanted you to kind of comment on what Darren shared with us about having to reform a division in state government and these cutbacks. And it just felt like there was a little inconsistency about prosperous economy, living off one-time money and having to make massive cuts. And we'll let you talk to that, Darren, but I wanted to get the panelists to speak to that.
First of all, I'm going to say, Darren, I'm glad you have that job and not me. Thank you for taking on the hard thing. So the bifurcation of the
just
funding.
the double message that we have the most prosperous state,
Yeah.
and then we're whacking jobs.
Well, I think it goes back to the cycle that I brought up in my first slide. Is we have lots of resources out there. We've got funding, we've got regulations, we have lots of protections, but I think it gets layered so deeply that we don't always understand how it works and how to best maximize it. I think sometimes in the past we haven't always talked to each other. We tend to have silos. So to me, it's kind of, even though there are cuts and there have been issues and there's waiting lists and things like that, I think what I loved about this particular panel is there are a lot of people on the ground now who are really trying to address that and kind of even things out and look at creative ways to fund. And so one of the things I've enjoyed about my job is I know that I have colleagues here who really have some stable funding sources, maybe some problems in how we get it out there. But I'm also seeing the community step up through donations and in-kind giving and just rethinking how do we kind of spread this out a little more evenly and try to create more opportunities. So I'm not an eternal optimist, but I think it's just really kind of how we reorganize that and rethink it and talk to each other and bring employers in too into this discussion.
Yeah, good to hear. Other comments on that, Darren? I don't know if you want to comment or if Val does.
Hello. Yeah, it kind of goes back to what I said at the very end. I believe, my personal philosophy is that we have a responsibility, especially when we're doing so well, to reach out and take care of those among us who can't take care of themselves. I think part of that responsibility is governmental. But in Utah, we don't tend to think that government is the answer to all of our problems. I think it's a public-private partnership. I think we need to have more individuals, more corporations step up and assist government in whatever way they can to solve these difficult problems. And if we can't do it when we're as prosperous and successful as we are right now, then we're in trouble. And I think we'll pay the price down the road. So I really think the answer is in public-private partnerships that can solve and be innovative in finding solutions to the challenges we have.
Darren or Angie, if you want to add something.
I think I'd better.
When I said the term whacking jobs, I apologize, but it was just this restructuring, and I was like, man,
Nobody understands that better than you.
this
I
is
appreciate
significant.
that, and I know that that's a technical term. So our funding is stable, and our funding is solid, as I suggested. What had happened at the state office, what happened only in the vocational rehabilitation program, given that it is our largest, was that we continued to enroll clients when we didn't have the funding to support everyone who was eligible. And especially when there's an economic downturn, back to my comments of before, often our individuals with disabilities are the last on board and the first off. And we saw that happen when the economic downturn occurred. And so suddenly you've got a lot of people that need services, but you don't have the resources. And when, with the way that this budget works at US, it's absolutely the most complicated budget I have ever experienced in my career, is that you make a decision to serve more people than you have the resources for, and it affects you 2 and 3 years down the road. That's when it hurts. That's when the pain comes. And that's what we're trying to adjust to, is create a legacy of a continuous, predictable funding level and budget. So the positions we cut, none were in our vocational rehabilitation counselors. We have kept that part of the program strong. I fundamentally believe that moving to workforce services will bring in a lot of the administrative advantages that we need, especially in areas that we had to cut. So and one final point about that, we are on this order of selection, aka waiting lists. But it's so important to us that we continue to invite people off the waiting list, even if it's just a few at a time, because we're worried that the message to the public is waiting lists are permanent, there's no point in applying. And that's not our goal. Every night I think about what can we do to keep to move more people off those waiting lists. And that's really fundamentally why we've done it.
That's great. Thank you. We are so close to running out of time, so I've got one more question for our panelists, and I want each of you to answer it. And we're going to start with Val and kind of work this way. So Stephanie gets a break on this, gets to think, Angie gets to think. But we've titled this The Bottom Line of Disabilities. And I want to just ask Val and everyone on our panel, in a very short phrase, what is the bottom line?
The bottom line of disabilities.
Yeah. Put it in a nutshell for us.
I would, that's a hard one. The bottom line of disabilities in my eyes is that, again, we have a responsibility to help people with disabilities, to help them be successful and have as productive a life as possible. I think, in a nutshell, that's the bottom line. We as a society should be all about helping those people find joy and happiness and success in every way possible.
Great. Darren?
Should have ended with Val. It is that we can move the needle. So Natalie, you started with some interesting data points around employment and unemployment, and we can do something about that. It is possible, and that's what we're committed to doing.
Angie?
So my bottom line is the same. People are people. People are employable. They deserve jobs. We should treat everyone equally. That's
Bring us home, Stephanie.
Okay. There's no pressure here. To me, the bottom line of disabilities is about being able to work, and it's in work that we form our identity, and it's how we contribute to the world. And I think the bottom line for me is that we actually might not have this conference in 20 years because we don't have to. It's just a given that everybody has an opportunity to work and know what that means, and know that they are an integral part of the world, and that their identity can be tied to that.
Very nice. So responsibility, move the needle. It is possible. Treat people well. Work, the value of work, people's identity, and when we don't have to have this conference anymore, we know we will have been successful. Let's give a big hand of applause to our panel.